So should you go to medical school? Well, let's see what the pros and cons of are to becoming a doctor in today's age. So first thing you have to consider when choosing to go to medical school is, are you really passionate about medicine? The process of going to medical school, going through the entire process and completing your residency is a grueling process. There's a lot of studying that is involved and a lot of time and dedication that is needed in order to complete your training and to become a fully fledged doctor. Some things that you have to keep in mind while going through medical school and residency is how to remain detail oriented. That's making sure that all your tasks are completed in a timely fashion and in an acceptable manner that's up to your level of standards. Becoming a doctor is all about risking what is important to you, what can be done in the correct amount of time, and doing things as effectively as possible. This will translate into taking care of patients the most effective way as you can. So what do I mean by this? Well, if you have multiple tests coming up and multiple things you have to study for, you need to prioritize what you can study for in a reasonable amount of time in order to get the best results. At the end of the day, medical school is all about getting those good grades, as well as demonstrating yourself as an effective learner. This means that you're able to apply what you learned in the classroom to your physical abilities. That could be taking care of patients, going through rounds in hospitals, shadowing doctors, doing research. All of these can contribute to the way that residency programs can look at you and see if you're a good fit for their program. Another thing that you have to consider is, do you truly like medicine? That means that, do you like the subject, and do you think that you can go into a field of medicine that you think you can do for the rest of your life? If you really like working with kids, then maybe you go into pediatrics. But it's not just about working with kids. You have to think about how to interact with parents. And you have to think about how everything you learn in medical school is usually geared towards adults, though you do learn a lot about kid anatomy. So then you have to be able to translate this, and most of this can come through your residency program. If you really like working with the brain, and you really like how the mechanisms of the brain work, maybe you actually like the research behind the brain. This is different than medicine in terms of actually treating brain problems, such as aneurysms or brain tumors. So you have to ask yourself, do you really like the research behind it, or do you like actually treating patients that have these abnormalities? That's what you need to consider about medicine. One thing that gets thrown out a lot is money. It's expensive to go to medical school. If you don't have an MD PhD program sponsoring you, or some sort of scholarships or financial aid, then you can easily be in $250,000 in debt after your 4 years of training. Because of this, medicine usually does give out good rewards in terms of salaries. Now, everyone thinks that doctors make a lot of money, and honestly, it all depends on what field specialty you go into. Some specialties, such as neurosurgery, cardiovascular surgery, orthopedic surgery, those pay out a lot. Dermatology is another one. And then some of specialties don't really pay that much, including family medicine. So when you think about medicine, you shouldn't really think about the money, even though that you will be comfortable in terms of paying off your loan, which might take a while. But the reward that comes with medicine is all about treating the patients and being able to constantly use your brain in order to solve problems in an interesting landscape. So you need to ask yourself, are you doing it for the money, or are you doing it for the opportunity to help heal people? Now, not every specialty involves with blood or biological samples, but a majority of specialties do. And as a doctor, you might be exposed to them frequently. So you need to also ask yourself, are you willing to handle samples like urine, feces, saliva, sweat, things like that on a regular basis? Something that ties into that is, are you willing to be a leader and lead a group of nurses and your medical staff in order to treat a patient, come up with a care plan, and being able to deliberate in a way that allows the patient to be healed the fastest and most efficiently way as possible. This includes giving orders through a computer to send medications at certain time intervals throughout the day, and making sure that you follow up with nurses or the patient to make sure that medications are followed through. And now this is mostly in a hospital setting, but if you're in an outpatient setting, that includes making sure that appointments are fulfilled in a reasonable amount of time. And when the patient does come to see you, you make sure that they are taking their medication, but they are following their specific health regimen plan. So at the end of the day, it's definitely a people person job. If you don't like talking to people, medicine's probably not for you. Now, all of this isn't to say that you can't become a doctor and do research. That's definitely an option that's available, and it is very well needed in terms of clinical science. Being able to think of how some sort of treatment or medication may affect the body as a whole is something that we're taught in medical school, and applying that to a research perspective is incredibly important in discovering new drugs and new treatment plans. So with all this being said, you really need to ask yourself why you're going into medicine, what do you really want to do in the future, and will going through medical school and the tough regimen plan really help you succeed in life? I hope this helped. I know this is a lot that can go through your mind, and it really helped me to think about these sort of questions when I wanted to decide to go to medical school. So if you do like this sort of topic and you want to see more just like this, maybe why research might be the way to go or something like that, please do comment. I hope you liked it. Please like and subscribe, and I hope to see you again soon.